Hello, I'm Dr. Blair. I'm a medical consultant and I'm working with Elixinol to talk to you about endometriosis today and how CBD can play a role in the treatment and the prevention of this very difficult problem. We're going to be going for about 20 minutes and then we'll open it up for questions at that point. The topics that we're going to cover will be the burden of disease, the conventional causes and treatments that are available for endometriosis, as well as the endocannabinoid deficiency, which is very prominent in this disorder. We'll talk about some of the evidence for CBD's benefit, and we'll discuss some of the serving sizes, and I'll answer questions at the end. Now, in this area, we're going to look at endometriosis, but I also want to share that there are parallel concerns about adenomatosis, which is the formation of cystic type of structures that are in the uterus, as well as pain syndromes like dyspareunia, the pain with intercourse, and the pain that's associated with menses. These are similar and they may have some overlap with endometriosis, but we're going to be focusing mainly on endometriosis. So what is endometriosis? Well, what we're talking about here is that endometrial cells will move outside of the uterus and they'll implant on other organ structures on the peritoneum inside the abdomen. That produces quite a bit of pain because not only are they present there and enlarging, they also attract nerve function. And so they're actually creating nerve fibers that go to them. They create new nerves in the area as well as a vascular supply in order to take care of their endocrine functions. There's also infertility associated with it. Perhaps that's a result of the scarring, or that may be the underlying problem that has to do with a hormonal deficit where the hormones are not working properly or the endocannabinoids are not working properly. There's menstrual irregularity and either heavy bleeding or irregular bleeding, so that this is part of the syndrome and many of the characteristics that go along with endometriosis. In addition, there's some indication that there is an increase of cancer, particularly ovarian type of cancer and some others. In addition, there's huge amount of complications that can be associated with endometriosis as a result of the therapies that are incorporated in order to try to solve this particular problem. So the problem is huge. We're talking about 10 million Americans who are affected by this disorder. And it starts as early as age 8. This is really quite incredible. And it goes on through the 40s. You would think that it would rescind after age the 40 and into the menopause, but I actually talked to some people who continue to have some of the symptoms that are associated with what is thought to be endometriosis in their condition. And that may be because although the endometrial tissue is not actively cycling, but it may have those nerve fibers and it may have that vascular supply still present. In 2002, endometriosis was estimated to cost about $22 billion, but that was 15 years ago. You can imagine that those numbers have doubled and tripled and perhaps even quadrupled because of the number of procedures that are being incorporated to try to rectify this condition and take care of the symptoms. As many as 40% of patients with endometriosis are infertile, and so that's prompting a lot of them to go on to other surgery and additional consultations so that many of the costs may not be related to just the endometriosis, the pain. It may be related to getting pregnant as well. In addition, we have to look at the total picture and see that women who are dealing with endometriosis and chronic pain are clearly impaired. They're not going to be able to function nearly as well in the workplace, and they may face chronic disability and be absolutely unable to work. These are huge costs for the society. What causes endometriosis? Well, there is some indication there is a genetic propensity to have endometriosis. It'll be passed down from generation to generation. But there are other theories. It's not clearly specific about what those causes are or what those genetic factors are. There's about 10 different genes that might be involved with the condition. The predominant theory is one that there's a retrograde menstrual flow, so that instead of the menses and the sloughing of the lining of the uterus near the period time coming out through the vagina, that it actually goes up the fallopian tubes and gets deposited into the peritoneal cavity, and where it can be deposited on any of the surrounding structures. The problem with that is that some of the cell types and the characteristics of the cells are not the same. So even though it is a very popular theory and it's easy to understand, it's a little too simplistic for a clear definition of a causal arrangement. There's many more likely culprits. One of them is the peritoneal defect. And what I mean by that is that there seems to be something that is being termed a leaky peritoneum. And leaky is that it allows for some of the endometrial tissue to attach to it and form bonds and to make and attract the endometrial tissue for that binding. And as a result, it's termed a leaky effect because the tight junctions seem to be not functioning properly. And so this attachment can occur. In addition, there's a thought to be that there is an immune defect, because when these endometrial cells implant on the peritoneum, then there should be a scanning effect by the body, by the immune cells, to identify that tissues are really out of place. But in this case, they are not eliminated. They are allowed to continue, so that there seems to be this immunologic allowance for this condition to continue. If we're looking at some of the pathways disease, so those were the simplistic versions, but I want to focus in on some of the other thoughts and some of the other findings that have been determined for endometriosis. One of the things has to be with the cell migration. So the cells have to come out of the uterus and they've got to get implanted within the peritoneum. And those implantations can be very painful. They can implant on the bowel, on the bladder, on the endometrial, could implant on the fallopian tubes, and that can produce scarring that will cause infertility and a great deal of problems, and even adhesions, which can become very complicated and even result in bowel obstruction at some point in time. But there are other mechanisms that are quite interesting here. One of them is angiogenesis. So just because those cells get implanted on the peritoneum and they're positioned there, that doesn't mean that they're going to be supplied with any special blood supply. But in this case, they actually harness a significant blood supply coming to them. In addition, there's neurogenesis. So these cells actually develop their own neurologic connections, and nerve cells, which are called neurites, actually form and connect to the spinal cord where they're actually mediated. So these particular tissues have their own separate innervation. In addition, we did talk about the leaky peritoneum and how it can attach there, and there's that impairment of the immunologic system that allows those attachments to continue. Furthermore, we're seeing an apoptosis resistance occur. So you can imagine that you have the endometrial cells, they have produced a rich endometrium ready for implantation, and then they need to disintegrate, they need to dissolve, and they need to slough. Now those cells shouldn't be staying there, they should be dissolving and disappearing. But in fact, the normal mechanisms that are involved with that allow those cells to continue. They don't go through the normal death and destruction, the natural processes that are normally there. So all of these things could play a role. And as it turns out, the endocannabinoid system is connected to all of them. The usual and the conventional treatment is really, it's for physicians have generally said, well, deal with it. Take some analgesics, take 2 aspirin, take a couple Tylenol, and work with it. There's also mechanisms for using birth control pills to regulate the period and reduce the cycles, because there is some evidence for a decreased sensitivity for progesterone on these particular cells in these women. In addition, to the hormones and emphasizing the progesterone phase, which decreases the amount of endometrial tissue, there are other drugs, and particularly pain medications that might be used. And they're even looking at drugs that would stop the formation of blood vessels, to form the angio blockers that would prevent, the same as the formation of the blood vessels, the same as what might happen in cancer and some of the immunologic diseases. Of course, there's surgery, and there's a huge amount of money that's spent on laparoscopic surgeries and procedures to remove these implants that are on the peritoneum. And of course, there's sterilization. When no results can be found, I suspect women are having their uterus and their fallopian tubes are removed, as well as their ovaries, to eliminate this vexing problem for them. So the endocannabinoid system is very, very closely involved with all of these processes. All of the mechanisms that are going on within the normal menstrual cycle are really controlled and fine-tuned using the endocannabinoid system. Now, we've seen the endocannabinoid deficiency in many other disorders, whether it's irritable bowel syndrome, migraine headaches, or chronic fibromyalgia, but it's also very prominent in endometriosis, and I'll show you the evidence for that. Other control factors for the endocannabinoid system are related to the diet and drugs and toxins. They can cause disruption of the endocannabinoid system. We don't know exactly why this is happening and what these causes are, and we hope to learn more in the future. The evidence for endometriosis and the endocannabinoids is quite extensive. In the first place, we're seeing measurements of the cannabinoid type 1 receptors being very depleted. On the other hand, the anandamide and some of the stimulators and the agonists for the endocannabinoid system are quite elevated. And the enzymes that are part of the endocannabinoid system, that the ones that break down the cannabinoids, they are frequently deficient in this disorder. So you have clearly a significant imbalance. The endocannabinoid system is very important for the neurites, and they use the endocannabinoid type 1 receptors, and they are stimulated by the agonist. So the nerve formation for these particular lesions are regulated and modulated through the endocannabinoid system. The same thing is true for the blood vessels, and using the VEGF factor, which is part of that stimulation by the endocannabinoid system. Now, those cells in the endometrium have to get out, and they've got to cross past the fallopian tubes, and they have to get to the peritoneum. Why do they leave there? Why do they migrate? Once again, we know very well that that particular process is orchestrated by the endocannabinoid system. And there's a new type, at least we're aware of the GPR18, which is a new receptor that we've identified as an endocannabinoid type of receptor, which is instrumental in releasing those cells so that they can migrate. And there's another endocannabinoid, which is the NAGLY, which activates the GPR18. And this is very important for the cell migration. If those cells don't get out of the uterus and get implanted, then we're not going to have the formation of this endometriosis and these implantation. Some other evidence shows that the size of the endometriosis types of cysts that form are actually proportional to the endocannabinoid type 1 receptor, as well as the interleukin type 6 cytokine that's being produced. Now, these are important targets that we could use phytocannabinoids for, and I'll talk to you about those in a moment. In addition, we're seeing that progesterone actually acts through the CB1 receptor, and that's the way it naturally functions in making the changes that are going on within the endometrium. What we're finding in endometriosis is that the apoptosis is inhibited. We clearly understand that the endocannabinoid system is regulating much of the apoptosis and the control of the number of cells in the population. We certainly see that within the immunologic system, where the endocannabinoid system is regulating the number of macrophages and the inflammatory type cells that are circulating in the immunologic situations. So cannabidiol has the ability to provide a number of benefits in endometriosis. I've listed off a number of these benefits, particularly for the analgesia that is available for cannabidiol, the neurotransmitter regulation that is available, as well as the immunoregulation, the control of the number and the types of cells that are populating in an inflammatory situation or in the normal situation. It also has the ability to restore apoptosis to those normal cells. CBD is effective at increasing the amount of apoptosis that are in macrophages and in cancer cells. But for this type of cell, for the endometrial tissue that cycles and has a time period for activation and then dissolution, cannabidiol could restore that balance and restore that particular function in the cells. And that's been clearly demonstrated in terms of the endocannabinoids that are active in these cell types and that are not active in the endometriosis. In addition, we see good evidence for cannabidiol holding a role as a hormone regulation. And I think this is really important. A lot of the mechanisms for those hormones are probably working through the endocannabinoid system. And we've got evidence for cannabidiol working within the hypothalamus and the pituitary and adrenal axis. This should be no different. We're seeing a restoration of tight junctions. Now, I pointed out to you that in the peritoneal cavity and then in the peritoneum, this is an important function that we don't commonly think of in terms of leaky areas of the body. We usually think in terms of the leaky gut or the leaky brain. But here's another area of tight junctions that are very important to maintain in order to maintain good health. In addition, we're seeing CBD restore normal menses in many cases. And I didn't mention it here, but there's also the benefit of reducing hot flashes for women who are actually menopausal. On the right, I've put a picture of the compound that was standard procedure and the standard prescription for dysmenorrhea and painful periods that women once had in the 1890s. And in fact, cannabinoids were actually used by Queen Victoria in that same time frame. So how to use cannabidiol for this condition? Well, I like to start off with a standard of about 15 milligrams twice a day, and then adjust it early and boldly to control the symptoms. Your object is symptom control. Any of the formats are okay, just what works best for that individual and controls their symptoms. I want you to make changes to the therapy based on their response. And what I find is a very effective way is to monitor them when they're taking their first dose and give them additional guidance. They always have more questions, and you can get a feel for them actually having a good response to the CBD and make adjustments right then and there. The duration of effect is from 6 to 12 hours, so it's good for a twice-a-day dosage. Some people like to use it 3 times a day. If you're looking at the benefits, then the patients see the benefits. They may want to increase the dosage to get the benefits all the time. And if you're looking at analgesia, you might need to maintain a more frequent level in order to control that particular pain. The target dose is probably going to be in the range of 30 to 60 milligrams a day. That's what I see with immunologic type of problems and many of the pain syndromes that we look at. Now, with other medications, you tend to have to increase later on. With CBD, after a month, you are likely to be able to reduce the amount of CBD that you're using because their endocannabinoid system is going to be restored. They're going to be functioning much, much better. And in that process, they will not need as much of the CBD for modulation. So who should be using cannabidiol? You got to look at the symptom unresponsive, those people who are at high risk and have some problems, people with impaired organ function, and those who need really maximal support and protection. Certainly cannabidiol is effective in a broad range of conditions. This is quite interesting in the effectiveness of CBD that could be for all of endometriosis and a number of the pelvic problem issues and women's issues. So to summarize, I want to go over that endometriosis is a huge problem for an enormous number of people in the population. Not all of the people will come forward. The average time is about 6 years before women who have dysmenorrhea or endometriosis type symptoms will come forward to do something about it or seek medical help. And classically, women have been considered hysterical as a result of bringing up these complaints. And so it's not well received, and it's not well accepted, unfortunately. Now, endocannabinoid deficiency is common, and in this particular syndrome, this is very much the case. And I really want to emphasize how important that is and how you can make modification of the endocannabinoid system using CBD. It addresses all of the pathways that are involved in gynecologic disorders and can get women back on their feet and functioning and improve fertility as well. CBD is supported in plenty of preclinical studies and in practice. Lots of women are benefiting from this right now. There's no significant adverse effects, no toxicity, and no significant drug interactions. And the dosing is actually quite modest. It doesn't take a large amount in order to get these kinds of results quickly. So that's the end of my talk. All of the references that I've used for this, and I've put them into a folder for you to view and for you to have access to at the slides and references bullet that I have listed there. Delighted to talk to you about this. I'd love to share more of my information with you in upcoming lectures. Thank you very much for watching.